Does your baby need to poop every day? The answer is no, and we're going to dive into that in today's video. This is Dr. Obidi, pediatrician at Partners in Pediatrics and Family Health, practicing for over 20 years, and CEO of Newborn Prep Academy, where we create content to help moms with newborns. So today I want to answer that question about the frequency of your baby's poop. This comes up often, and I have made some videos before in the past about the topic, but I think it's worth doing another one because it's a question that comes up all the time. Now, and especially so because earlier on, your baby typically has multiple bowel movements every day. In fact, one of the concern moms have and think may be a problem is that every time the baby feeds, they poop. And that is also common too, and that is actually normal, the normal physiology earlier on in the baby's life. But somewhere after the first or second week, some babies actually start to have less bowel movements and can actually skip days, and even a few of my patients have skipped a whole week before they have a bowel movement. Now, this may sound like, oh my God, really? But yes, they do skip days often, and that can be normal. If you think about it, feces, a baby's poop, is really residue. It's whatever they haven't digested from their food, which at this point is really just milk for most babies up until 4 to 6 months of age. Most of that, the poop is really basically residue, whatever has not been digested by the body that comes out the other way. And so if you have a baby who's really digesting a lot of their food, oftentimes it does take a while for that baby to build up enough residue to be able to push that out and have a bowel movement. And something else you'll notice is that for a lot of babies, there's a lot of straining. They're red in the face sometimes, and they're crying or just fussy right before a bowel movement. This can sometimes be normal as well, because the longer the poop stays in the colon, so the longer your baby's stool is in the colon, bacteria go to walk on it and they produce all kinds of gases. And so your baby just becomes more gassy and more uncomfortable. And for those babies who are skipping days, may also be smelly as well. And all of that can be normal. Now, you always want to check with your pediatrician, always want to check with your baby's medical provider to make sure there's nothing else going on, especially if they're not feeding well, they have a fever, difficulty breathing, the bellies just seem like it's really hard and distended, not just when they're crying, but just all the time. Those are some signs to make you worry, or if there's just a weird rash that is not usual for the baby, or they're having red stools, and it looks like they're bleeding in their stools, or vomiting. Those would be some signs to look for to let you know maybe there's more going on here, and to seek medical attention right away. But if all those things are not happening and your baby looks fairly comfortable, or looks comfortable, I should say, in between their bowel movements, this probably is just your baby's normal stooling pattern. Especially, most importantly, if the stool comes out looking like normal baby poop. So that will be anything from just a runny, sort of thick runny consistency like pea soup, or a soft sort of semi-formed stool like soft toothpaste, or just very watery, mushy consistency. So think about grits or very watery oatmeal. I know this very it's funny to use all these food items to describe poop, but I find that it's a beautiful way to be able to tell parents what's normal for a baby stool. But those are some ways your baby stool can look, and all that is normal, right? So if again your baby is having any of those stools, then it's probably not constipation. Now, if a baby is having very hard stools, they're coming out like really hard round balls or like pellets, like a rabbit stool, that most likely is a concern, and you do want to bring that to your pediatrician's attention because they will be looking into why their stool is that consistency. Now, what can you do again if a baby is having infrequent stools? One is just watch, if they're otherwise okay and you've cleared it with your pediatrician, I would just watch. You don't have to do anything. I have had parents come in with stool softeners, and those could be glycerin suppositories or just over-the-counter stool softeners for babies. That oftentimes is not necessary if your baby's stool does come out normal. Now, something else you could do is just use a probiotic. Sometimes that can be helpful. It just helps to restore some of the normal gut bacteria, or encourage normal gut bacteria, which can sometimes help with the gassiness and fussiness and the bloating that your baby might have when their stool is sitting there for longer periods of time. So that's something else you could try. And every now and then, if your baby is formula fed, you could try different formulas. Sometimes babies will just digest a different formula differently, and the stool may sort of come out more frequently, which you may be happy about. So there you have it. Your baby does not have to have a bowel movement every day, and that oftentimes can be normal. You do want to check with your pediatrician or medical provider to make sure there's nothing else going on. And if everything is well, then we'll just leave baby alone. And oftentimes this will just get better as they get older, and will be less of an issue. Again, this is Dr. Obidi, pediatrician at Partners in Pediatrics and Family Health and CEO of Newborn Prep Academy. If you're in the Washington County area, Maryland, we'd love to be able to care for you. Just call the office at 301-791-7060. All right, take care. Bye for now, and see you in the next video.